Hello and welcome to Health Matters, the channel where we explore various topics related to health and wellness. Today we're going to talk about a very common but often overlooked condition, vitamin D deficiency. Vitamin D is a fat-soluble vitamin that plays a vital role in many aspects of your health, such as bone health, immune function, mood, and more. But did you know that according to some estimates, up to 1 billion people worldwide have low levels of vitamin D in their blood? And that this can lead to serious health problems, such as osteoporosis, depression, diabetes, heart disease, and even cancer? In this video, we're going to explore what vitamin D deficiency is, what causes it, what are the symptoms and complications, how to diagnose and treat it, and how to prevent it. We'll also share some interesting facts and stories about vitamin D that you may not have heard before. So stay tuned and don't forget to subscribe to our channel and hit the bell icon to get notified of our new videos. Before we dive into the topic, let's start with a quick quiz. How much vitamin D do you think you need per day? Is it A. 400 IU, B. 800 IU, C. 1500 IU, D. 2000 IU? Leave your answer in the comments below and we'll reveal the correct answer at the end of the video. Now, let's get started. What is vitamin D deficiency and what causes it? Vitamin D deficiency means that you have very low levels of vitamin D in your blood. This can impair your body's ability to absorb calcium and phosphorus, which are essential for building and maintaining strong bones and teeth. It can also affect your immune system, your brain, your muscles, and your hormones. The main cause of vitamin D deficiency is lack of exposure to sunlight. Vitamin D is sometimes called the sunshine vitamin because your body can make it from cholesterol when your skin is exposed to ultraviolet rays from the sun. However, many factors can limit your sun exposure, such as living in a place with long winters, high latitude, or air pollution. Spending most of your time indoors, especially if you work in an office or a night shift. Wearing sunscreen, clothing, or hats that cover most of your skin. Having dark skin, which reduces the amount of vitamin D your skin can produce. Another cause of vitamin D deficiency is inadequate intake of vitamin D from food or supplements. Vitamin D is naturally found in only a few foods, such as fatty fish, egg yolks, liver, and cheese. Some foods, such as milk, yogurt, cereal, and orange juice, are fortified with vitamin D, but the amount may not be enough to meet your needs. Supplements can help, but you need to be careful not to take too much, as this can cause toxicity and side effects. Some people may also have a higher risk of vitamin D deficiency due to certain medical conditions or medications that affect their ability to make or use vitamin D. These include kidney or liver disease, obesity, malabsorption disorders such as celiac disease, Crohn's disease, or cystic fibrosis, certain medications such as anticonvulsants, steroids, or HIV drugs. If you have any of these risk factors, you should consult your doctor and get your vitamin D levels checked regularly. What are the symptoms and complications of vitamin D deficiency? Vitamin D deficiency can be hard to detect because the symptoms may not appear for a long time or may be vague and nonspecific. Some of the common symptoms include bone pain or tenderness, muscle weakness or cramps, fatigue or low energy, mood changes or depression, frequent infections or illnesses. If left untreated, vitamin D deficiency can lead to serious complications, such as rickets, a condition that affects children and causes softening and deformity of the bones, leading to bowed legs, knocked knees, or a curved spine. Osteomalacia, a condition that affects adults and causes softening and weakening of the bones, leading to fractures, pain, or difficulty walking. Osteoporosis, a condition that causes loss of bone density and increased risk of fractures, especially in older adults, women, and postmenopausal women. Cardiovascular disease, a condition that affects the heart and blood vessels and increases the risk of high blood pressure, heart attack, stroke, or heart failure. Diabetes, a condition that affects the ability to regulate blood sugar levels and increases the risk of type 2 diabetes, insulin resistance, or metabolic syndrome. Autoimmune disease, a condition that affects the immune system and causes it to attack healthy tissues, such as in multiple sclerosis, rheumatoid arthritis, or psoriasis. Cancer, a condition that affects the growth and spread of abnormal cells, such as in breast, prostate, colon, or skin cancer. As you can see, vitamin D deficiency can have a significant impact on your health and quality of life. That's why it's important to diagnose and treat it as soon as possible. How to diagnose and treat vitamin D deficiency? The best way to diagnose vitamin D deficiency is to get a blood test that measures the level of 25-hydroxyvitamin D, which is the main form of vitamin D in your body. This test can be done by your doctor or a lab. The normal range of vitamin D levels is between 20 and 50 nanograms per milliliter, Inc/ml, but some experts recommend a higher range of 30 to 60 nanograms per milliliter for optimal health. If your vitamin D level is below 20 nanograms per milliliter, you have a vitamin D deficiency and need treatment. The treatment depends on the severity of your deficiency, your age, your weight, your medical history, and your doctor's recommendation. Generally, the treatment involves taking vitamin D supplements either orally or by injection, in doses ranging from 1,000 to 50,000 IU per day or per week for several weeks or months, until your vitamin D level reaches the desired range. You should always follow your doctor's advice and monitor your vitamin D level regularly to avoid taking too much or too little vitamin D. Taking too much vitamin D can cause toxicity and side effects, such as nausea, vomiting, constipation, kidney stones, or calcification of soft tissues. Taking too little vitamin D can cause your deficiency to persist or worsen. In addition to taking supplements, you should also try to get more vitamin D from natural sources, such as sunlight and food. We'll talk more about that in the next section. How to prevent vitamin D deficiency. The best way to prevent vitamin D deficiency is to maintain a healthy lifestyle that ensures adequate exposure to sunlight and intake of vitamin D from food or supplements. Expose your skin to sunlight for about 15 to 30 minutes per day, preferably between 10 a.m. and 3 p.m. when the sun is strongest. Avoid sunburn and use sunscreen if you plan to stay longer in the sun. Eat more foods that are rich in vitamin D, such as fatty fish, salmon, tuna, mackerel, sardines, egg yolks, liver, cheese, and mushrooms. You can also eat foods that are fortified with vitamin D, such as milk, yogurt, cereal, and orange juice, but check the label for the amount of vitamin D per serving. Take a vitamin D supplement if you are at risk of deficiency or have a low intake of vitamin D from other sources. The recommended dietary allowance, RDA, of vitamin D for most adults is 600 IU per day, but some people may need more or less depending on their age, weight, health status, and vitamin D level. Consult your doctor before taking any supplement and follow the dosage and frequency instructions carefully. By following these tips, you can ensure that you get enough vitamin D for your health and well-being. Vitamin D is not only important for your bones, but also for your immune system, your brain, your mood, and more. So don't neglect this essential nutrient and make sure you get your daily dose of sunshine and vitamin D. Now, let's go back to the quiz we asked at the beginning of the video. How much vitamin D do you need per day? The correct answer is D, 2000 IU. According to some experts, the current RDA of 600 IU per day is too low and does not reflect the latest scientific evidence on vitamin D and health. They suggest that most adults need at least 1,500 to 2,000 IU per day to achieve optimal vitamin D levels and prevent deficiency and its consequences. However, this is not a universal recommendation and may vary depending on individual factors. Therefore, it's best to consult your doctor and get your vitamin D level tested before taking any supplement. That's all for today's video.